Hi, I'm Sarah Compton-Bishop. I'm Chair of the Board of NHS Highland, and I'm just doing a quick video today to tell you about a few of the highlights from our latest board meeting, which took place on the 29th of July. So we looked at our usual items, so we look at minutes and assurance reports from our governance committees so that we can check what's happening there. And we also looked at finance and the financial plan. Obviously, that's a really important area of focus for us, given the financial position. But what I wanted to talk about today was some papers that we took through the board and approved, which are really exciting for NHS Highland, and I think really signify a change in the way that we're going to do things in the future. So there were three particular papers that I suppose I'm referring to, but they all pulled together. So the first one was where we got an update regarding action against the annual Director of Public Health report that we took. We initially accepted the recommendation 6 months ago, so we had a 6-monthly update where we could see the progress, which has been really good to see. We also took a paper updating us about where we're going to go with our strategy for the organisation. So this follows on from our last board meeting where we approved that we would refresh the strategy and create a new committee to look at strategy and population health, and that's an important bit. And we also then took a paper where the board approved that we would join Argyll and Bute Council in looking at options around what's called a single authority model, which is all to do with public sector reform and how we might organise ourselves as public bodies, organise ourselves differently in a local area to deliver better outcomes for people. So I suppose I'm pulling on all three of those papers, or as one of my team members said, it's like threads of a plaid or a tartan kind of weaving together, because they all take us a step further in something that we've been talking about for a long time. So talking about population health isn't new. Talking about prevention, early intervention, that's not new. Talking about tackling health inequalities isn't new. But what is exciting for me now is that where we've just talked about them in the past as something we should do, but something that was very difficult to drive forward, we're now starting to put in place the foundations that will push us to do the work and drive us to make a difference. So first of all, kind of in accepting the recommendations from the Public Health Annual Report 6 months ago, that was really an important step forward. So the report was all about tackling health inequalities, and that's difficult because it's not something that the NHS can do on their own. It's about the way that people live, their quality of life, their environment, and healthcare. If anybody's familiar with sort of public health concepts, what we deliver in healthcare services only accounts for a tiny percentage of what makes a person well. So much of it is to do with where they live and the quality of their environment and their lifestyle. So we had accepted those recommendations 6 months ago, and we got an update at the latest board meeting where we could see some really good progress against the actions and the recommendations. But it's clear that there is more work to be done, and that is something that will go into our new committee, which is going to look at population health and strategy. So that was great to see. We had an update on where we're going to go with our strategy and how we measure our performance against that. And it ties in really well. So the board had already approved the establishment of a new committee to look at strategy and population health. But what's also happened is Scottish Government have published some really important documents. One in particular is their new population health framework. So really not just looking at how we deliver healthcare services, but actually what makes a population well. And that's, of course, much broader than just the services you access in hospital. So that was really exciting, and that kind of really tied it all together. And then the last thing was looking at a single authority model in Argyll and Bute. So single authority model is one way to refer to it, but actually maybe it's better to talk about it in terms of public sector reform. So Scottish Government also published a public sector reform intention earlier this year. And what that means really is looking at a local area. So in this case, we're looking at Argyll and Bute, looking at the public sector organisations that exist or operate in that area. So the NHS, the council, but it could be broader. It can be education, it can be other response services. And thinking about how those organisations might organise themselves differently and work together differently to deliver better outcomes for the people in those communities. And it's really, really early days, so it's quite difficult for me to explain to you what that might look like. But essentially, it's the things that we always hear people talking about. You know, we know in some of our areas that workforce is scarce and that different organisations compete for the same staff. We know that buildings are really expensive to maintain and don't always do what we need them to do. You know, there's a lot that happens out in the community, as it should. So we know that people talk about, you know, reducing duplication, but there are also gaps that we need to look at. And in the past, that's always felt like a very aspirational thing to do. But this decision that we made at board about moving into a space where we can really get a blank sheet of paper and think about how we might organise ourselves differently with other public sector organisations to deliver the things that our communities need, that's really quite exciting. It's going to be a different space. It's going to be a new way of talking about these things. And of course, it will be a thorough process. We can't do these things on our own. We absolutely have to discuss it with staff and communities and other stakeholders. But I think it's really exciting because we've been doing things in the same way for a really, really long time in the public sector. And I think this offers us a chance to really question ourselves and think about how we could do things better for our communities. So I'm really excited about that. And we've got some brilliant board members who all live in Argyll and Bute. They know the area, they understand the rurality, they get the transport stuff, myself included. And we're really excited about joining our council colleagues and being creative in that space about how we could do things differently. So that was the main thing I wanted to talk about. And none of this stuff is going to happen overnight. But I think it's an important step forward because agreeing our governance and our performance management approach is really, really critical. Governance should support the work that we want to do, not be a barrier to it. So rearranging ourselves and thinking about what we measure and how we measure it is a really key step forward in doing things differently. So those are my highlights. As always, you can watch a playback of the meeting on the web. I mean, you don't have to watch the whole thing. You can just skip to the sections that you want to, and we'll publish the minutes in due course as well. And I'll see you next time. Thanks.